And the movements of the TMJ include elevation, depression, protrusion, and retrusion, as well as right and left lateral excursions. So here I'm going to show you some of the movements of the TMJ. The first one we're looking at is mandible elevation. Now this is mandible depression. This one is mandible protraction. And this one is mandible retraction. Now let's talk about the specific muscles of mastication. For this we have a couple of muscles, including the masseter. We also have the temporalis muscle, the medial and lateral pterygoid, which are these muscles more internally. And all of these muscles are innervated by the branches of the mandibular nerve V3. So as for the masseter, if you notice right here, the masseter, the origin, it's the zygomatic bone and the zygomatic arch. The insertion is the lateral surface of the ramus of the mandible and the angle of the mandible. And the nerve supply is the masseteric nerve. And the main action is to elevate the mandible for bilateral contraction. As for your temporalis, the origin is the floor of the temporal fossa. Some fibers also originate from the temporalis fascia. The insertion is the tendon that passes medial to the zygomatic arch and it inserts into the coronoid process and anterior border of the ramus of the mandible. The nerve supply is the deep temporal nerves, the anterior and posterior branches. And the main action is the elevation of the mandible for bilateral contraction and retrusion of the mandible. For the medial pterygoid, the origin, it's the medial surface of the lateral pterygoid plate. This is going to be for the deep head. And for the superficial head, it's the body of the maxilla. The insertion, it's the medial surface of the ramus and the angle of the mandible. Nerve supply is the medial pterygoid nerve. And the main action is the elevation of the mandible and lateral excursion of the mandible to the opposite side of the contracting muscle. As for the lateral pterygoid, the origin is the greater wing of the sphenoid. This is going to be for the superior head. The inferior head is the lateral surface of the lateral pterygoid plate. The insertion, it's going to be the pterygoid fovea, which is a small depression of the anterior aspect of the neck. The nerve supply, it's the lateral pterygoid nerve. And the main actions is protrusion of the mandible for opening of the mouth and lateral excursion of the mandible to the opposite sides of contracting muscle. The muscles of mastication are going to be innervated by the trigeminal nerve or cranial nerve number 5. We're going to get started with the mandibular nerve or mandibular branch, which is the one you're seeing here in blue. This one contains general sensory and motor fibers. It leaves the middle cranial fossa and it enters the infratemporal fossa via the foramen ovale, which is the foramen right there. In the infratemporal fossa, it lies deep to the lateral pterygoid and it branches into an anterior and posterior divisions. It also branches from the main trunk or stem before splitting into anterior and posterior divisions. So we're going to have a medial pterygoid nerve, which supplies the medial pterygoid muscle, and it gives small branches to the tensor tympani and tensor veli palatini muscles. And the meningeal branch, which enters the cranial cavity through the foramen spinosum and supplies the dura mater of the middle cranial fossa. Now let's go over the branches of the anterior division of the mandibular nerve. We're going to get started with the masseteric nerve. This one is the one you're observing right here in yellow. This one passes through the mandibular notch to reach the deep surface of the masseter muscle, which it supplies, and it also contains sensory fibers from the anterior aspect of the temporomandibular joint. Next is the lateral pterygoid nerve, which supplies the lateral pterygoid muscle, which is the one you can see here in pink. Over here, we're going to have a deep temporal nerves, specifically an anterior and posterior branch. This one ascends deep to the temporalis muscle to supply it. And lastly, we have the long buccal nerve, which is the one you can see here in yellow. This one passes between the two heads of the lateral pterygoid, and it runs anteriorly and inferiorly, and it emerges onto the cheek from under the ramus of the mandible, and it gives sensory innervation to the skin and the mucosa of the cheek. As for the branches of the posterior division of the mandibular nerve, we have the auriculotemporal, which is the one you can see here in yellow. This one originates by two roots that encircle the middle meningeal artery, and it joins posteriorly to the artery. It then ascends superficial to the zygomatic process of the temporal bone towards the temporal region, accompanied by the superficial temporal vessels. It gives sensory innervation to the auricle, external acoustic meatus, tympanic membrane, temporomandibular joint, and the scalp. And it gives off the parotid branches containing postganglionic parasympathetic fibers from the otic ganglion. Another branch of the mandibular division is going to be the inferior alveolar nerve. This one contains motor and sensory fibers, and it descends medial to the lateral pterygoid to enter the mandibular canal via the mandibular foramen, and it runs within the mandibular canal and supplies sensory innervation to all mandibular teeth of the corresponding side. This nerve also gives off the mental nerve, which emerges onto the face via the mental foramen, and it supplies the sensory innervation to the lower lip and the chin. Before entering the mandibular canal, it gives off the mylohyoid nerve, and it supplies the mylohyoid and the anterior belly of the digastric muscles. The other nerve, which is part of the mandibular branch or emerges from the mandibular branch, it's the lingual nerve. This one descends medial to the lateral pterygoid, anterior to the inferior alveolar nerve, and it gives general sensory innervation, such as touch, pain, and temperature, to the mucosa of the anterior 2/3 of the tongue and the mucosa of the floor of the mouth. It is located high in the infratemporal fossa, and it is joined by the chorda tympani and the intrapetrosal branch of the facial nerve. The other branch is going to be the chorda tympani. This intrapetrosal branch of the facial nerve originates from the facial nerve within the facial canal, just above the stylomastoid foramen, and it joins the lingual nerve in the infratemporal fossa. This structure contains special sensory fibers for taste, for the anterior 2/3 of the tongue, and preganglionic parasympathetic fibers. The preganglionic parasympathetic fibers terminate in the submandibular ganglion, and the postganglionic parasympathetic fibers from the submandibular ganglion supply the submandibular and sublingual salivary glands. This one's right here. Now, the otic ganglion is a small parasympathetic ganglion located in the infratemporal fossa, just inferior to the foramen ovale and medial to the mandibular nerve. It receives preganglionic parasympathetic fibers from the glossopharyngeal nerve via the lesser petrosal nerve. The postganglionic parasympathetic fibers leave the otic ganglion and join the auriculotemporal nerve, traveling with the auriculotemporal nerve to reach the parotid gland, which they supply.